Treatment of stroke. A stroke occurs. So what happens next? After calling 911 and being transported to a hospital's ER, an individual who has suffered a stroke receives a rapid clinical evaluation from ER doctors and probably also a neurologist. This process typically involves computerized imaging of the brain, known as a CT scan. If the CT scan reveals that there has been no brain hemorrhage and the symptoms of stroke have been present for less than 4.5 hours, a clot-busting drug known as tissue plasminogen activator, or TPA, may be administered by vein in order to eliminate the blood clot that is causing the stroke. Approximately 30% of stroke patients will experience a good outcome after receiving TPA. However, if an individual shows no neurological improvement by 1 hour after the administration of TPA, or if the immediate use of TPA isn't possible, the patient may then be a candidate for a procedure known as endovascular clot removal, or thrombectomy. One of 2 FDA-approved devices, either the Penumbra or Mercy device, is used during this procedure, performed through a groin puncture, typically by an interventional neuroradiologist, also known as a neurointerventional surgeon. These devices work differently. One is designed to suction and the other to drag an offending blood clot from a brain artery. Also, FDA approval has been granted for a newer device that consists of a self-expanding metal meshwork tube or cage that also acts by dragging an occlusive blood clot out of an affected brain artery. All of these devices are intended to restore normal brain blood flow and place the patient on the path to a recovery. Endovascular clot retrieval needs to be initiated within 8 hours after the onset of stroke symptoms. However, the sooner it is performed, the better the chances for a positive outcome. Strokes are serious business, but doctors today possess powerful technologies that finally give hope to stroke victims and their families for a positive outcome.